What's up, everybody? Welcome to episode 3 of Pro Talks, where we sit down with professionals making an impact at work and in life. I'm Barrett Ball, CEO and founder of The Super Professional, and on this episode, we're diving into a very important conversation: black and white codes, code switching, confidence, and culture. Today's guest is a native from Stone Mountain, Georgia, graduate of the great Bethune-Cookman University and Florida A&M University, content creator, clinical pharmacist, brother of Omega Psi Phi Fraternity Incorporated. Please welcome my dog, no pun intended, Dr. Torré Anderson.
Hey,
what's good, bro?
Thank you.
Good to have you here, man. How you feeling?
I'm feeling great, bro.
Good.
It's a good time, and I really love how you've grown the business so fast in such a short time. Like, you've really done a good job. So
appreciate that, bro.
Really, let's dive into the topics and
let's get to it.
We can talk about.
Okay, yeah, man. I appreciate it. So I like to start off these convos with the guest providing a little more background as far as your journey into medicine or your journey into your career, what drew you to the field.
Okay. So I do get this question a lot. A lot of people ask me how I chose pharmacy over medicine, basically being a physician versus a pharmacist. And for me, it was really based on my PSAT score, or that practice exam that they gave us in middle school. And I had a strong math and science. So going into that route, it gave me a bunch of options about engineering, physician, pharmacy, and I knew because, we were both in the band. So we had high aspirations of going to like Jackson State, FAMU, Cookman, all these different things. And I knew FAMU had a great pharmacy program. So for me, it lined up with what I wanted to do at the time. Going into high school, the more we got closer to college acceptances and really figuring out what we wanted to do, I locked in on pharmacy a lot more. So I had a nice 5-year plan coming out of high school graduation from 2014. And 5-year plans, for those who don't know, are very important when you're trying to chase your success, because it keeps you on the pathway. And you can plan and God laughs, that's what they say. But most of the time when God laughing, he'll push you along the way. So if it's lined up in his vision, it's always gonna make sure that you're on the right track. So pharmacy for me, I was deterred a little bit because they had the situation with the band. So of course the money was funny over there at FAMU, but it ended up right back on track. So going to Cookman, I got my foundation, which is where I was trained classically in biology. I really love learning so much about chemistry, organic, Bio 1, molecular, all those different things really put a foundation that I still use in medicine today. And understanding those things helped me to really push me along faster when I got to grad school. So coming out of 2018, going straight into grad school, it was a big thing for me. Just having that foundation and really excelling and going forward.
Okay, that's what's up, man. Like you said, that the plan of going to FAMU still ended up, in your plans, but just getting there, I had to shake it up a little bit. But hey, man, you're right where you belong. So I'm happy for you. Right. When did you first realize that being black in a predominantly white space felt different?
Okay, that's a good one. So you already know, coming out of, for those who don't know, I've known this man since middle school. So going from middle school, high school to college we've been black our whole lives, 365 days a year. So for me, going from a black middle school to black high school to black college, I didn't learn what it meant to be black in a white space until I did an internship with the biology department. So we had a nice summer internship where we partnered with UF, and specifically for my professor, Dr. RW, she put me on, if she ever sees this video, thank you so much for putting me on and setting me up for success. Her internship portion, we went down to UF, and we also connected and we went up to the NIH in Maryland. And understanding how big medicine can be and the different components of different regulatory affairs, or med affairs as they call it sometimes, it was so important to see that aspect, because I don't think I would have ever gotten that if I didn't do that internship. So that was another big reason for me to go further into pharmacy as well. But as far as understanding being a black person in a white space, going to the NIH, I didn't see that many black people anywhere, like nowhere at all. And doing research with her, the biggest moment I can attest to was I did research under her. She submitted it on my behalf. I didn't know she was gonna do it. She submitted on my behalf and it got accepted to the American Public Health Association conference. So I'm now presenting on one of the world's biggest stages, and I wasn't just a poster presentation. Like a lot of people thought I was doing a poster. No, I was giving a live presentation, almost like a TED Talk. So for me, seeing the crowd, it was very, it was causing a great anxiety in me. I'm like, man, am I prepared? Am I ready? Like, you know, I'm from little old Bethune-Cookman University. And with that mindset, I kind of had to grow up on it. You know, as Dr. Wells says, I had to grow up on it because understanding, yes, you do come from this small background and this all black background, and now you're in the face of white faces. You have to understand that you're still just as big, if not bigger than most of them. So I did what I had to do. I presented, it went well, and I earned my stripes that day. So understanding what it means was that's a prime example for me of what it meant. Just understanding that, yeah, I see a bunch of white, but I know who I am. So that was a big thing for me in learning that lesson in undergrad.
Most definitely, most definitely. Yeah, knowing who you are, I think is very important, especially when you find yourself being the underrepresented person in the population. Like,
the minority.
You know, it's easy to, you know, look at yourself as less than, because that's what, you know, that's what we're taught. Like, not taught, but like that's what, you know.
It's definitely ingrained into us. And I'm glad I had professors or mentors who taught me to think outside of myself in the bigger world, but also challenged me to rise to those occasions. Because again, coming from Bethune-Cookman, nothing was handed to us.
Yes. Yeah.
Any success I have, nothing was handed. So that's one thing I can always attribute to my journey, and knowing that everything I have, I earned.
Yeah, most definitely. Most definitely. I like that answer. So to go into a little bit more in depth, have you ever felt pressure to tone down parts of yourself to fit in?
Oh, all the time.
Really?
All the time. Okay. For me, I kind of learned this lesson in grad school, but when you're working on, we have what we call IPPEs, which is your institutional pharmacy practice experiences. And that's where you can either go to a hospital or a retail chain and work under the pharmacist there. So for me, being a 6'1" black man, you know, you're educated, you got a little bit of knowledge, and I wasn't a true grad student, or excuse me, I wasn't on the 6-year path like the other pharmacy students. I was a grad student. I wasn't undergrad going into grad. Right. So some of the pharmacists I worked with kind of looked at me like, you're young, you don't know what you're talking about. But in reality, like, hey, I'm actually a graduate, I'm degreed, I'm a big dog. Right. And so I had to check myself though, because I realized I got something they want, so I gotta humble myself a little bit, but I never really let anybody try to like play on my head. And again, that's just lessons I picked up from undergrad of how to navigate and deal with other adults. And sometimes, you know, people, the adults in your workspace, they may not be as palatable as they should, but you still have to find a way to navigate and play the game. And you can get your get back, but it's a certain way you have to do it. So I've definitely been told I have to shrink myself. I've been called arrogant, cocky, all these different things, but I look at it and say, they call Kobe Bryant cocky. They call LeBron cocky. They call Lamar Jackson, Beyonce. They call all these people cocky. But one thing about all those people, they produce. They show up. They do their job. They work. And if I'm doing my job, I'm working, I'm producing, I got something to show for it, hey, it just rolls off my back. Yeah, so most definitely. Just like Deion Sanders said, what's that quote he says? If my confidence. My confidence isn't dictated by what you believe about yourself. Yeah, that's true. Yeah. Shout out to the Sanders.
No, facts. Yeah. It's facts. So do you think when it comes to code switching, Let me backtrack a little bit. In your own words, like what would you say is your definition of code switching?
Man, my definition of code switching is like, it's survival. I mean, you playing the game, so it's survival. It's always been that way, or at least for me, what I think about for Black people has always been survival. You know, if you ever seen that movie, Great Debaters, the character that Denzel Washington played, that's a prime example of code switching, because he would go from a highly educated professor speaking to students about history, theology, research, and all these different things, but then he's talking to the sharecroppers at night in a barn all the way off in the cut of the county, telling them how they can rise up and, you know, get out of this racist town or overcome the situation they're in. So that's the biggest example of code switching. I kind of use that every day at work or in any environment I'm at, when it's professionalism, just because I understand that my opinions on the world will not be deemed applicable in the workforce. So you may have a strong opinion, you may have, you know, the right answer even sometimes, but it's a certain way you have to go about it. Otherwise, it's you in the fire. Now your job on the line, because you're replaceable. We're all replaceable at work.
Most
you know,
definitely.
you can be the best performer, but Tom Brady's replaceable.
100%.
So just code switching, you have to be mindful of where you're at, who you're talking to. And it's not always, a lot of people think code switching is, oh, let me change my tone so I can speak more properly and in a higher voice, and I'm using bigger, fancy words. Sometimes it's just knowing, hey, what to say and when to say it.
Most definitely.
Yeah.
Time and place.
Yeah, it doesn't always have to be this drastic change between, man, what's up, y'all boys? Yeah, and then I switch over and slide over into, hey, good morning. I think yesterday was a great day, and we have a lot of productivity, and hope quarter 2 was just as good as quarter 1. That's not code switching. That's just you
being someone you're not.
Yeah, you being someone you're not.
So there's a clear difference between code switching and you know, impersonating someone who you think would be accepted by the people that you're around.
Right.
You know what I mean? So I feel like a lot of people get that mixed up. You know what I mean? They feel like when they go into their jobs and they're around, you know, people of opposite races and things like that, they feel like they have to conform to, you know, their way of conversing, or their topics of conversation and things like that. Which, in reality, you don't have to.
Yeah, you don't have to.
You can be yourself, but you know, just keep it professional.
Yeah,
that's it.
And sometimes it slips out.
Yeah.
Sometimes.
Yeah, it does.
I've had moments where it slips out.
Yeah.
And you know, they laugh when it does, but I'm genuinely serious when it happens.
Right.
So it's a funny situation until it's not funny. I think a few times it's for me, that's when it slipped out is, you know, somebody says a little akiki, or they want to joke, or you know, they push the boundaries of how much they can try you at work. And then I come back out of a bag, and now it's, oh, let me not play with him no more. Oh, okay. Yeah. Okay.
Right. Sometimes you gotta let them know.
Yeah.
You gotta set that boundary.
Definitely boundaries.
Yeah, for sure. So you kind of answered a little bit. Kind of answered my next question when I was asking about, is code switching more about survival strategy? You're saying survival.
Yeah, survival. And I mean, we could be candid on here. I'm a pharmacist, so most pharmacists, average pharmacist, makes about 6 figures. So if you're looking to enter in the realm of pharmacy, that's a good incentive to have. Now, there's some other cons to it, but that's a good one to have. But it's survival. If you're making 6 figures, who wants to lose 6 figures off of saying the wrong thing at work? You know, and you see a lot of people, like nurses, other doctors, they'll go online and say something like, I don't know if you said you've been watching Love is Island.
Love Island? Yeah.
There's something about the girl on there saying something against the Asian community. She got a chance at $100,000 that can blow up in her face, all because she says something stupid on her social media.
Yep.
So you gotta know when to turn it on, turn it off.
Everything
doesn't have to be said. So it's survival. I would hate to wake up and they tell me I lost my salary because of something I said.
Facts. So how do you going into more of the realm of confidence and identity, you seem like a pretty confident person.
Yes.
So have you ever struggled with imposter syndrome? And if so, how did you deal with it?
I don't think I wouldn't say I had imposter syndrome, but one thing that I look into, and I know Cam Newton said this on his podcast, but it's a difference between a game manager and a game changer. I've always liked to think of myself as a game changer. So anytime I walk into a room and I see the quote unquote big dog or something, I like to think, okay, how do I match up to this person? If I'm stacking up well against you, everybody else, I'm not worried about you. So I try to be as methodical as I can in looking at the situation, any situation I walk into. But I wouldn't say I have imposter syndrome. Sometimes I know that I am not qualified for a job or not qualified for a position or something I'm going out for. But most of the times, it's really not about even being qualified. So I've never really fell into that thinking I'm less, because I always like to think of myself as more, because you think of yourself as more, if you do get a chip on your ego or something does bruise you, you can bounce back. A lot of people don't even have the foundation of confidence that they need walking into a situation. So when it goes left, they're left with less. So I'd rather be left with something than nothing at all. So if I walk into an office and we interview, and I've had a few interviews in the Atlanta area where suited and booted, ready to go. Hey, I'm ready to start tomorrow if you need me to. And they tell me, we love, you got it.
You got it, yeah.
And then I get that notification that says, we moved along with somebody else. I still know I'm the big dog.
Right.
They know that.
Right.
So it's just a matter of, they didn't pick me, cool. We move on to the next. So
There's one opportunity for you.
yeah, so imposter syndrome never really been my thing.
Good. Yeah, I feel like people who have dealt with it, it does kind of bruises some people's confidence. You know what I mean? They let that define them in a sense and what they bring to the table. And I don't think that's
stop. Don't let your losses be your story. And that's the biggest thing that I had to learn too.
Right.
Anytime you lose something, there's something better on the right.
Exactly.
Right. So if you're letting your losses define your narrative, I'm trying to think, who is somebody who's just, we've seen take L after L after L. Prime example, I like to use him sometimes when I'm talking to the kids. If you're watching somebody like Derrick Rose, right? We know Derrick Rose, phenomenal player until he had the injury, messed him up. You know, from there, he just could not bounce back. But nobody says, man, Derrick Rose, he was a sorry player. That doesn't define his career. We know he had the injury. Yeah, it took him out the game for a little minute, but nobody says Derrick Rose is a sorry player.
Right.
Nobody says, I'm trying to think, thinking just all these examples, so many people, but bottom line is nobody says, man, you took, like for me example, you remember when we was trying out for drum major and the situation in the gym. You remember? Yeah, you remember?
Yeah, in high school, I remember that.
Nobody can tell me now, like, man, you know, yeah, he got a good career, but that's a blemish on his record he just can't live down. Nobody says that.
Nah. People forgot about that.
People forgot about it because there's so much more to my story than that one blemish on my record.
Oh yeah.
So you don't let losses define your narrative.
Most definitely. What helps you stay grounded and authentic in spaces that weren't built with you in mind? For example, your current role.
What helps me stay grounded is knowing that when I show up, I'm here to work. I got my money before they got their work. Hey, he got so many quotes. I could go on and on.
And he's quoting our college band director again, by the way. Shout out to Dr. Wells.
Yes, Dr. Wells. Thank
if
you
you ever
so
see
much.
this.
Thank you so much. But I'm showing up because I have a job to do.
Yeah.
And they expect, for the amount of money, the 6 figures we're talking about, they expect that job to be done, not only completed, but completed well. So that's what keeps me grounded. All the emotion, all the feelings. You know, I notice on TikTok and Instagram, a lot of these people say, I come home and I cry from work. Not me.
Right.
I'm sorry, I'll tell anybody. I don't do that.
Y'all don't do that.
I don't do that.
Ain't no feelings.
No feelings. This is business.
Yeah.
So keeps me grounded in a sense, because I understand that my clinical skills, as good as they are, I'm here to provide them for a service. Now I can definitely change Uncle Earl or Grandma Jean's lives in the pharmacy and make sure we're optimizing their therapies, but there's no feelings involved.
Yeah.
You know, it's none. I can't do that, because if I'm taking home that baggage, what does that do to me?
It affects your life, your personal life.
It affects my life.
Yeah.
So,
speaking from personal experience, I used to do that. Like, I'd be so invested into what I was doing at work,
yeah.
and that I'd take a lot of stuff personal, and it affected my life. Like, I found myself not happy because I'm trying to take on not only my own personal issues, but the issues that happen,
life stuff that's happening in your life.
And taking that work stuff home with you is not
good.
Not good. Like you said, just making it about business and kind of putting your feelings to the side.
Yeah.
And kind of just locking in on what needs to be done. But you find yourself in a way better place.
For sure.
How do you say it?
Compartmentalizing.
Compartmentalizing.
That's right. Take your time.
Yeah. It's been a long weekend, but I'll say compartmentalizing. Those things and making sure that you are in a good space mentally. Speaking of mental health, what are some of the things that you do to balance, your demanding workload or career, in personal life?
That's a very good question. So for me, I start and end my weeks. So if I'm starting the week on Tuesday to go to work, I will, before I do that, I go get a massage.
Okay.
I don't start off the week with stress.
Okay.
Then once the work week is over, I go get a massage. So that way I know I'm starting fresh, I'm ending fresh, and then I go out and do what I gotta do. As far as mental health, phone is on do not disturb after a certain hour. That's just sleep hygiene, making sure nobody disrupts my sleep. I get all my sleep that I earn.
Hours. Yep.
And then from there, again, I deal with so many people's problems as a pharmacist. So of course I'm a problem solver.
Yes.
But at the same time, I want to be able to let people know, set up that boundary. Like, I can help you to a certain extent, but it's got to be solution oriented. I don't need to I'm not the person to vent to no more. I can't hear you dump, and you're not ready to work.
Yep.
So if you're ready to dump on me, be ready to work.
Be ready to find a solution.
Because we about to find a solution real quick.
Yep.
And I really enjoy having that boundary now, because some people, they understand it. Some people still kind of learning the lesson. We're still working on it. But overall, it makes sense, because again, when you're working in the healthcare position, whether you be a pharmacist, a nurse, a physician, PA, whatever, you're seeing so many problems, and some of the problems are simple fixes, like, hey, your blood pressure is sky high because you're not taking medicine. Oh, I'm not taking medicine. Why are you not taking medicine? You don't taste good. It's like, and I don't want to simplify it to just that, but sometimes that's what it is. And then you hear the problem, and it's like, I got to go home and deal with my girl, or I got to go home and deal with my son. My mom is sick. My mom is sick. My mom's not sick, y'all, but those are things that people have to deal with as professionals. And then they hear you with a problem like this, and it's kind of like, why are you not taking your medicine? So you just can't put yourself in those positions to destroy your mental health by hearing other people's baggage or problems. So that's how I manage it.
Most definitely. That's a good way to do it, by the way, as well. Like I said, going back to the compartmentalizing thing.
Yeah.
Separating work stress from, personal life.
Right.
That's very important. Going back to more of the culture and representation piece, what role, or matter of fact, have you found a community of other Black professionals in your field, and how important is that to you?
So your first community is gonna be your classmates. So for me, I made enough good connections with my classmates. Cops class of 2022, shout out to y'all. I made enough good connections with them. So sometimes late at night, if I'm working in the pharmacy, I can call them, hey man, I got a question. Or we can just chop it up, shoot the phone. Things like that. Hey, have you seen this new job posting? Have you heard anything? I want to transition. How do you go about this? Put me on game. I built a community enough in that where it's easy for me to network in itself. And if they don't have the answer, they don't have the solution, they'll put me on to somebody who does. And then from there, coming to Atlanta or coming back from Florida to Atlanta, it was easy for me to connect with the other pharmacists because you're jumping straight in.
Yeah.
And what a lot of people don't realize about these positions in healthcare, it is a little grace period for you. You can say, I'm a new grad, but when they're paying you that check, they don't care. Yeah, they don't care about that.
Yeah.
They want to know, are you saving? Are you being cost effective? Are you doing the right thing, optimizing therapy? Are you not killing people?
Yeah.
Sometimes they don't even care if you're saving lives. Are you not killing people? And if your excuse is, well, I mixed up the blood pressure medicine with the depression medicine, I'm a new grad, I got you. We're going to send you your paperwork.
Right. Paperwork is in the mail.
Yeah, we're going to send you your paperwork. And that's it.
Yeah.
That's it. So, it really gets to a point where you have to understand what you're taking on in this position. So, yeah, it gets
So utilizing your classmates is kind of like the community. Would you say, is there any like type of community outside of the classroom or?
Yeah, so I have you're a professional. My LB, Rodney, finance plug, shout out to him.
Shout out to Rodney.
And I have a friend, Bree, the one I used to tell you about in Tampa. Shout out to her too. If you want some great cookies, y'all, the TCM cookie, that is a great cookie spot to have. I wish I could have brought some actually.
Yeah.
But having other Black professionals, whether it be in business, healthcare, Darius, he's in Grenada doing his veterinarian school, things like that. Yep. I've set up a network where most of the people around me, I went first, essentially. I got the doctorate, but then right after me, Joquan, some other friends, Brianna Johnson. I just have so many people that got their doctorate not too much further after me. So it's like, you look at a lot of people in my group, they either have master's or doctoral degrees. That's my circle, that's my network. So Brandon, he's working on his doctoral degree right now too. Yeah. So understanding that I have my pharmacy community and then my regular community is also on the same level as me, that means something to me. So another thing too is when my friends, of course y'all don't do it, but certain people that I like to say, like I associate with you, I kick it with you, when they start downing themselves too much, I tell them, hey, cut that or you got to go. Because if I'm hanging with you and I only hang with this upper echelon of people, when you down yourself like that, it's saying that I've chosen wrong. I'm messing up. Because if you're supposed to be a reflection of me or you connected to me, then what does that say about me?
Yeah.
So I try to limit that and cut any of that nonsense. And if they can't, get out of their funk, I help them as much as possible. Then maybe you need some time apart. Yeah. Maybe we need to get you some help or something. Yep. But I can't be there for you.
Yeah. Yeah. And that's a unique way of thinking about it. Because typically a lot of people do depend on their friends that are doing better than them to kind of take them up with them. Right, what I mean?
But and one thing, I saw this video and, of course it was a quick little TikTok video, but it was a strong message. It's easier to pull somebody up when they put their weight and they're forced to come up with you. But if you're just trying to pull somebody up, say you're on a cliff and you're trying to pull them up and it's just dead weight, it's harder to do that and you're more likely to fall down with them. So I try not to reach in and be that helping hand unless I know you're ready to come, because it makes no sense for me to, what we call in the business, caregiver burden or caregiver fatigue. where you're doing so much to pull this person out the funk or doing so much to try to lift them up financially, mentally, however that looks like. And now all of a sudden you're the one in a situation that you didn't need to be. So I try to make sure all of my people are, put together. That's why I do phone calls.
Yeah.
And, some people, y'all know me, I'll FaceTime before I text.
Yeah.
I'll FaceTime before I text because I want to make sure I see like, you can text me, like, I'm good.
Like people say, you got to lay eyes on you.
Yeah, I got to lay eyes on you because you can tell me, oh, I'm fine, and I FaceTime you and you in the dark corner crying your eyes out. Like, hey, what's going on with you? So, I mean, that's just how I operate, man.
Yeah, that's real. So when it comes to the future pharmacists, like the younger students, specifically Black students, what would you say to those Black students that are entering those spaces, like the pharmaceutical spaces and things like that? What would you say to them? What are some nuggets that you would give to them?
I will tell them, like somebody told me, shout out to Amir, he told me this my first year of pharmacy school. Most pharmacy schools, when you come in, they give you your white coat the first semester because you're starting the journey. At FAMU, we do not believe in that. We will give you your white coat in your third year, first semester, that fall semester, because you passed the clinical classes necessary to go into the practice sites.
Okay.
The advanced practice sites.
Okay.
So one thing I was told was, and I'll tell this to them, once you get that white coat, you are now in charge of somebody's life, point blank period. And you can be a student thinking like, well, I got a white coat, I'm just the intern at Walgreens. You mess up because you're gonna be touching the pills. You're not gonna verify the medicine, but you're gonna be touching the pills. You're gonna be grabbing the medicine, handing off things, giving advice, giving consults. And of course it's under the direction of a pharmacist, but we know, especially in a retail setting, it gets a little busy where they say, hey, I trust you, go ahead and do that. You're in charge of somebody's life. So if you're giving out wrong information, if you're giving out the wrong drugs, that says a lot about your professional standard and your practice standards. And again, you being in charge of somebody's life, you should not be the reason why somebody's grandparent is taking the wrong medication that could potentially put them in the hospital. And if you don't care, or you feel like, well, I'm just here because this is a grade and it's not the profession for you. Because some people, they'll say like, hey, well, I just want to do pharmacy, get this degree so I can leverage it and transfer it into this. No. It's not that type of business. If you think that is because of what you see around some pharmacists, some people in the industry or whatever, understand that even those people have a level of care and standard of excellence that they have to give, whether it be through clinical research, whether it's through active retail pharmacy or hospital pharmacy. There's a standard of excellence that all of us strive to give. And if you're coming in saying that, well, I seen the pharmacist, he did this, it's not the right business for you then. So
basically, for our viewers, if you just trying to become a pharmacist to get that money on, this may not be the profession.
You're not gonna have fun, young. Right. You're not gonna have fun, young. Trust me.
Right.
Because one thing about it, the world of pharmacy is small, and especially as a Black pharmacist, somebody can say my name now. I'm like, man, Dr. Anderson? Dog that went to FAMU? Yeah, I know. I know. It's that small.
Yeah.
It's people, and especially with LinkedIn, I mean, we talked about this a little bit before the cameras rolled, but the internet connects us to so many people we never even thought we connect with.
Most definitely.
Sometimes I post on LinkedIn, I'll never forget when I first got licensed. I said, hey, I passed my license exam. Atlanta, I'm ready to work. I'm open to work, whatever. 800 likes, 100 plus shares, 300 comments, like all these people looking at me, scoping my page out, headhunters trying to figure out how to get this man a job, other pharmacists from other states overs, and congrats, and hey, if you interested in coming up this way, reach out to me. It's small. It's so small. So if you're out here mismanaging your care or causing harm, patient harm, we don't need you. Yeah, we don't need you.
Yeah. Yeah, that's good, man. Going more so toward the reflective realm. Have you ever had a moment where you stopped code switching and just let it all out? I know you said earlier you had a couple moments, but like, was there just a time where you were just like, forget it?
So sometimes I work those night shifts, and a lot of people think the night shift is the chill shift because there's nothing going on, but wrong. I'm here to tell you that's wrong. And a doctor, he kept putting in an order that wasn't protocol, it wasn't the standard, no research behind it. So it's like, hey, doc, you can't do this. I don't get why I can't do it. I do it at the other hospital. I understand that, but the protocol here at this hospital, we have to do it this way, try this first, and X, Y, and Z. Well, I don't get why I'm even talking to you. You're just a pharmacist. Okay, well, instead of Dr. Anderson, you about to get Torré now. And now Torré has to tell you what you're doing can potentially harm this patient, and it's literally no evidence behind why you're doing this. So I'm gonna tell you, I'm gonna keep denying this medicine until you get it right. If you need me to come up there and talk to you face to face, I would love to do that.
Right.
And so even that for me is not too crazy coming out of DeKalb County, Stone Mountain.
Yeah.
But him hearing that at 4:00 in the morning, that shifts his tone.
Yep.
Now he's, all right, well, let me try it this way. Because everybody think they're the big dog until the big dog show up.
Yeah.
So if I tell you, I'd love to come and talk to you upstairs, you don't want to see me face to face. You don't want that smoke. So you was rah enough to be on the phone, but now that I'm coming to see you like a man, now it's, well, I'll try it your way. What changed? So things like that, I try to pause and consider of how often I let that out, because you don't ever want your reputation to be, oh, that's the professional that come out of a bag on you. You don't want that to be your name.
Yeah.
That's not who none of us are.
Yeah.
Nobody operates in aggression.
Yeah,
that's
most
unhealthy.
definitely.
That's unhealthy.
Most
so,
definitely.
but when it does come out, I let sure they know, like, it's not about to be none of that stuff you talking, all that rah and this, oh, I got it like this. All right, let's pull your card. Let's see.
Yeah. I truly believe as a professional, of course, like you said, you don't want to tarnish your reputation, but at the same time, you also want to be able to assert yourself, when need be, for sure. Because they're like I tell people, like any profession, there is going to be people there that try you.
For sure.
And you got to be able to assert yourself, let them know who you are. You know what I mean? Without, of course, being nasty or ugly.
Right.
Just to but make sure you're getting your point across.
Do it
you know
in
what I mean?
tasteful manner.
In a tasteful manner. Yeah.
Add enough force for them to understand, but enough bite so it don't happen again.
Exactly. Who or what inspires you to keep showing up fully as yourself?
Who inspires me? It's a few people, man. I'll say it's my community, because everybody knows how hard I work to be where I'm at. So I don't want to let my community down. And then I guess on the flip side, I do it for the haters too. I do.
We all do, yeah.
Yeah, like some of them, they don't want to see you shine. So if you don't want to see me shine, close your eyes. That's what I say.
Facts.
Close your eyes.
Put some shades on.
Yeah, put some shade. Do something. Look the other way. But I do it because mainly though for my community, and they understand that, once I graduated, everybody made the joke, well, now we got a pharmacist, but now we got somebody who can, help us with the medicine or talk to us about the medicine. Or am I taking the right things? And, even back in the day, like, I actually, before I transitioned into the hospital, working retail was fun, especially as a student. So people would come in, oh, can I get my shot from you? Yeah, I'm giving my cousin my shot, giving my girl my shot, giving her a shot. I'm giving like all these different people shot, and they actually want to talk and learn. So that was always a stepping stone for me, being able to counsel patients, but also just having conversation. So that, and I guess that goes back into code switching, because now I know how to talk to various groups of people and how making sure they understand why certain therapies are necessary for them specifically, because medicine is not one size fits all. Sometimes it's tailored specifically for different people, but being able to explain that and convey that information in the most simplest ways to people is a form of code switching to me, because now I know you understand it. There's no cap in the rap, as the kids say.
Facts.
And everybody's happy. And I remember one of the biggest lessons I had to learn was explaining it to a lady. She was anti-vax, and she actually she wasn't anti-vax in the traditional sense like some of these people. She was anti-vax because she literally lived in the woods. Yeah, I know, it was crazy. When she told me, I'm like, oh,
Interesting.
okay, yeah, very interesting.
Yeah.
But she lived in the woods. She was a very natural, herbal lifestyle. But when she heard about COVID and it was killing all those people and during the pandemic, she said, hey, I'm gonna have to break it this one time because she's not trying to go.
Oh yeah.
So I was able to show her the literature of not only the survival rate of people who have COVID, but they're vaccinated and they have more likelihood to not be on a ventilator and, die.
Yeah.
But I was also showing her the outcomes of people who took it, and when they did get sick, of course, there was minimal side effects. And I had 3 options for her because the pharmacy I was working at, Health Matters Pharmacy in Tampa, we had Moderna, Pfizer, and Johnson & Johnson. So I showed her the data, showed her which one is working better, which one would probably work more for her lifestyle. Because again, if you know the person doesn't like taking medicine, like doing shots, they're completely natural, why would you make them come back twice for a shot? So we gave her Johnson & Johnson, which is a one-time dose. She was happy. She was very thankful. The lady was crying the whole way through. But she was thankful that I was able to explain and give her some options to, make sure she was good out here.
Yeah.
Things like that make me feel better, but also I know that, hey, I really touched somebody's life right now.
Yeah.
So
making that direct impact.
Yeah.
And seeing the fruits of your labor too.
Yes.
Seeing people come back and let you know how your services made them feel and like how it changed their lives. That's what's up. Last question, I'll get you up out of here. If you could change one thing about how medicine embraces diversity, what would it be?
Oh my gosh, that's a get you canceled question.
Look, if you, I don't want nobody losing their job.
Go ahead and say it again. Let me hear it one more time.
So if you can change one thing about how medicine embraces diversity, what would it be?
Oh man. So we want to be more cognizant of the different backgrounds of people, right? So a prime example for Black people, there's a population of Black people with sickle cell. That's a directly linked disease state to Black people, African Americans.
Okay.
So if you have sickle cell, sometimes they can go into sickle cell crisis where the blood is so clotted up and including that they're not getting any oxygen. So they feel like they're in pain, like electric shock, it hurts to even live.
Yeah.
So we have to give them pain medicine. Sometimes in some practices, hospitals, because this is an emergency crisis, but some practices, they'll think the patient is a drug seeker. Like they just want control. So they'll be like, oh, well, just take some Tylenol, take some ibuprofen. And that's not being culturally aware, because now you don't even know, which is crazy because you're going through all this med school or pharmacy school, but now you're not even aware that a specific group of people get a disease state that presents it in this way.
Yeah.
So the simple test would be just, all right, they said they got sickle cell. Let's check their profile. Let's check their history. They probably do have it. If not, this is probably like a first time thing, especially in small kids. Because sometimes they think, oh, the parent just saying that because they want the drugs and the kid, nothing wrong with them.
Yeah.
And it's like, that's not being culturally aware.
Gotcha.
And I would say something we can change to do better in that aspect is listen. We have all this education, but sometimes health professionals, we don't listen.
Yeah, gotcha.
And what does that mean? Because if we're not listening to the patient, so we have this thing called subjective information versus objective. Objective is what I can visibly see, like your blood pressure, how your eyes are sitting, your physical, all these different things. And then subjective is what you're telling me. So if I'm looking at you and you're saying to me, which is subjective information, which I'm about to give, but if you're telling me, hey, my hands won't stop shaking and it really hurts. And I'm looking like, okay, the hands are shaking, but I can't see the pain. I can't feel the pain. Come back in the morning.
Yeah.
You're not listening. Like you're not listening to what they're saying. They're saying they're in pain and they came in there as the primary reason for pain and shakes. What are you gonna do about it?
Yeah.
And so we definitely gotta make a habit of listening. And sometimes that means checking your ego.
Yeah.
That means checking your ego. Because if you're not able to come off the high horse for a second and stop looking at it as a population base, like, oh, tremors and shake in a 30-year-old person, we know it's not Parkinson's. We know it's not anything that typically comes older in life. So you should really evaluate this and really check into this, not give them let's wait and see, or come back a little bit later, or maybe you did some hookah or something and you're a little anxious right now. It's like, nah, like, let's give them a full workup. You know, they here for a reason. They got some insurance. Let's do it.
They want a solution.
They want a solution, right? So it's really just an ego thing where we have to check our bias and our privileges sometimes as healthcare professionals. And it happens sometimes, and I can admit to it. I do it sometimes, but you have to check your privilege and bias and come off the high horse and remind yourself of why you're doing it.
Yeah. Most definitely, man. With that said, I mean, that's a good way to conclude the episode. To close out, man, you want to share any of your social media handles where people can find you?
Yes. My main page is Dr. Anderson_2. And then my pharmacy page, where you can see all my upcoming health tips and other speaking engagements, is at Doses of Success. So definitely check me out. Let's connect, let's talk, and this is fun, man. I'm really happy we did this.
Yeah, man. And once again, I appreciate you for coming out.
Yeah, for sure.
Thank you for taking the time out of your busy schedule. And with that includes episode 3 of Pro Talks. Be sure to like, comment, subscribe, and we'll see you next time. Peace.